Welcome everybody. I'm Sergio Genesini, and on behalf of the Venous-Lymphatic Ward International Network Foundation, I'd like to introduce you to the fourth educational video dedicated to the coronavirus outbreak not-for-profit project and their related containment at home of venous and lymphatic patients who might have some difficulties in attending their visits to their venous and lymphatic specialists. The fourth lesson is dedicated to venous active drugs, which ones and when. And as always, I like to start pointing out that this is indeed an educational video, and that in any way this can substitute the valuable, precious evaluation and recommendation of your general practitioner and of your venous and lymphatic specialist. So please always rely on them for your final assessment. We are indeed overwhelmed in these days by fake news, also in the medical world. And for this reason, we thought about focusing on venous active drugs in these specific lessons, both in their form of pills and of topicals. So looking at what is the real evidence-based data we have in terms of science on these substances. In the previous lessons that I really suggest you to enjoy before enjoying this one, so to be properly informed, we have seen how the venous blood normally is moving from the feet toward the heart, going against the gravity force. This is possible thanks to a system of valves that can break up. If this happens, then the blood falls down, create venous dilation, and create inflammation. Basically, the concept is quite simple. When there is a normal drainage, it's like a nice breeze is flowing inside the vein, not hurting in any way the venous wall. To the contrary, when the venous blood falls down, it falls abruptly with turbulence, like if a real tornado was coming inside that vessel, scratching the wall heavily, so that the wall reacts by releasing substances that we call inflammatory mediators that are responsible of the signs and symptoms we have discussed in lesson number 1. Now, this really sensitive wall is releasing then substances, and other substances in specific drugs can control this release, so to improve our signs and symptoms related to the condition of chronic venous disease, for example. The most studied one for sure is macronized purified flavonoid fraction that demonstrated that is able to improve the venous tone, to reduce the leg swelling. It is also able to improve the skin alterations we have discussed in lesson number 1, including also the opening of those holes we called ulcers. And it is able to improve several symptoms related to the chronic venous disease, again described in lesson number 1, improving in this way the quality of life of these patients. Another substance that acts on mediators of inflammation is rutoside, and this has demonstrated to reduce the leg swelling, improving some symptoms of chronic venous disease as well. Another substance, again, is calcium tobacylate that reduce, again, the leg swelling. It has some laboratory properties of antithrombotic agents, and at the same time it is able to improve some symptoms related to chronic venous disease. Another way of acting on the inflammatory process is restoring the integrity of the wall that was previously damaged by that turbulence, by that tornado. The tile in this case is called glycocalyx. Now, the glycocalyx can be restored by a substance called sododexide that has demonstrated to reduce this venous hypertension, to improve symptoms related to chronic venous disease and the related quality of life of these patients. It has been widely demonstrated in its ability of healing eventual ulceration. Of course, the ulceration must be treated not just by the drug, but by several measures of therapeutic actions, like, for example, compression at first. And then it has also demonstrated properties of antithrombotic agent. And on this, I recommend all of you to have a deeper look at lesson number 2, dedicated to the very important topic of the risk assessment of venous thrombosis. The most recent literature confirm that sudocetaxide and MPFF, so the micronized purified flavonoid fraction, are the 2 drugs that have been most widely investigated and that can be used in the wide spectrum of the chronic venous disease condition, with a high grade of recommendation for micronized purified flavonoid fraction in the last guidelines of 2018. If we move toward the topical agents, the problem that we see in the revision of the literature is that the different agents have been used all together, so making it difficult to understand which ones are really effective in the specific cases. For this reason, I like to recommend you to rely on your venous and lymphatic specialist to recommend the proper topical for your specific case. They could for sure help in edema, so in the swelling, and in the signs and symptoms like cramps, restless legs, as we discussed in lesson number 1, swelling, and paresthesia. But again, you really have to rely on your venous and lymphatic specialist for proper information on these topicals. Indeed, too many fake news are around in the medical world, and as discussed in the previous lessons, we have a project dedicated exactly on the topic in conjunction with the Dubai Expo. And we really welcome you to be part of this teamwork, both as health professionals or as non-health professionals, simply reporting in this website, even anonymously in whatever language, eventually encountered fake news in terms of venous and lymphatics. You can also report over here eventual doubts you have on the information you have been provided with, so that our Venous and Lymphatic Ward International Network Foundation Scientific Committee can get back to you with an evidence-based scientific answer, of course, for free, as all of this is a not-for-profit project dedicated to the health of your venous and lymphatic drainage. With this, I thank you for your attention, and I look forward for enjoying together with you the 5th and last lesson dedicated to venous answer self-management. Thank you, and please stay properly contained at home in these tough coronavirus days.